Welcome to the Foster Fathers podcast. We got Chris and Kyle here and a couple other guys, some no-name individuals from the state of Idaho that are trying to make a difference in the world of foster care. So we have Monty Prow and Alex Adams. And if you guys don't mind, please introduce yourselves. Tell us what you do and maybe a fascinating tidbit about yourself.
I'll certainly start. My name's Alex Adams. I'm the director of the Department of Health and Welfare, and been on the job for about 30 days now. So I'm completing my first month. And I said every day I drove home this first month, I drove home saying, "Oh, I didn't know the department did this or that." I learned we regulate public swimming pools. I learned we have programs for car repairs.
I might have something to talk to you about swimming pools. Then we'll save that for another time.
Yeah, I guess fascinating tidbit. I started my career as a pharmacist. I'm actually a fourth generation pharmacist. Dad, grandpa, great grandpa were all pharmacists, and grew up in a town called Defiance, Ohio, which my wife tells me is very fitting. If anyone's watched Scandal, the scandal happened in Defiance.
My wife's from Youngstown, Ohio. How far is that?
About 3.5. It's the other side of the state.
Yeah. All right.
Very cool. Well, we can talk about it here in a second, but I want to hear how you got from pharmacist to now. But maybe that's where we'll start after. Monty, why don't you go ahead and introduce yourself?
Yeah, thank you very much, both of you. And again, I can't echo what the director said enough. Appreciate what you're doing, both in your sort of podcast careers as well as what you do for Kids of Idaho. Again, native Idahoan, grew up right off State Street, actually not too far from here. Born in St. Luke's, and I'm just thrilled after spending a little bit of time in the military to come back. Last 22 years spent my career and working with juvenile corrections the last 5 years as the director over there. And what we've done at juvenile corrections is taken the deepest end system kids and reduced that by half through some wonderful prevention work done with our county providers and private providers in the communities. And that's some of the successes that we're hoping to duplicate on the child welfare side, is to look at what we can do when kids are safe enough and parents are willing and able to provide services in the home. And if we're unable to do that and the kids need to be removed for safety reasons, how fast can we get to reunification, working with that family, and then or the worst case scenario is termination of parental rights. What does that look like? So I'm just so excited to be here with you guys, and I appreciate the director for giving me a chance to support the Kids of Idaho.
That's cool.
I mean, we are fully in full agreement. The best way to change the outcome for Idaho is to help, from the bottom up. And this is the bottom, and this is one of the weakest points in the bottom, not because of the department necessarily, but just because of the circumstances of who's involved, the kids, and just it's a chaotic. One of our things is we like to talk about it's complicated. And so complicated things take a lot of attention and a lot of effort. So I have just a quick question just to get to know you guys a little bit more. Do you guys have kids? Is there a connection? Have you seen kids grow up? Monty, how many kids you got?
Thank you, sir. I have one child on Earth today. She actually just graduated medical school and is doing a residency in pediatrics. So the apple didn't fall far from the tree.
Yeah, very cool.
You, Alex?
I've got a 5-year-old daughter, so we're the family that isn't too dissimilar from many who started in their 30s and therefore had kind of a tough journey to having a child. And we are blessed to have a daughter, and she is the apple of my eye. And I was saying to someone the other day, her favorite word is no. So my prior job to this was state budget director. So I said, I don't know, maybe she'll follow, instead of being a pharmacist, maybe she'll go be a state budget director and follow.
The apple didn't fall far from the tree for the director either. That's fine.
Our 5-year-old has gotten into the, kind of that stage of lying and trying to pull a fast one on you. And she believes the more emphatic she says no, the more likely I am to believe her. That's where we're at. Yeah.
I was telling someone had a colleague that has a baby due in December, and they were asking what it's like, and I said, by the time they're 5, I'm doing the things I want to do, but being able to justify it as being a dad. We went go-karting last weekend. We went to the circus the weekend before, and it's a lot of things that I like to do, but I get to bring the kid along for the ride and use them as the excuse.
That's awesome.
Well, Alex, I mean, I know both Monty, you can speak to this as well, but the navigating from pharmacist to state budget to now Department of Health and Welfare, is that an intentional move for you? Is that kind of how did you end up here? And like kind of what would you kind of hope to accomplish through some your tenure in this department?
Yeah, I'll start. I mean, like I said, I trained as a pharmacist, started my career as a pharmacist. My first job in state government was about a decade ago. In 2015, became the executive director of the board of pharmacy for the state. So it was my first state job, and it was a small state agency, licensed pharmacists, pharmacies, DME outlets, and others. It kind of just grew in state government from there. So I went from that to being the state budget director to this. It was an intentional move. This is something that I pursued because I thought I could make a difference. I hopefully have a track record of having gotten things done in state government. You can see my wall of bills behind me of things that I worked on with Governor Little, helped pass Idaho Launch, helped pass.
You have a wall of bills. I have an In-N-Out cookie jar. It's probably
Yours is actually cooler. I actually really admire that. I see that Ben& Jerry's, and it's right after lunch as we filmed this, and I'm really craving that right now. So.
That just means you're an adult and I'm a child still. This is my garage.
So I hopefully people see that I have a track record of getting things done in state government, knowing how to work with the budget committee, knowing how to work with the legislature, knowing how to work with a regulated community. And I felt like health and welfare needed a turnaround of some sorts. And as I surveyed the landscape in terms of if I was going to do this, what are the things I would want to do? And child welfare outcomes was the most important thing that I felt like we needed to address. I've seen enough of the legislative oversight hearings on the topic, and I've read every recent OPE, Office of Performance Evaluation report on the topic.
Can you define that term for us? Well, you said it a second ago. The
OPE, Office of Performance Evaluation.
Oh, sorry. You talked about the family outcomes. Like when you looked at that, what do you mean by that?
Well, certainly, probably the biggest thing we're addressing right now is the number of homes that we have relative to the number of children. So we want to be a state that doesn't have kids waiting for homes. We want homes waiting for kids. We want stable placements. Every placement that a child has, there's trauma associated with that. We want good families that lessen the amount of moves. We want stable placements. We want low rates of maltreatment and repeat maltreatment and things like that. So I don't think you can make a bigger return on investment anywhere in state government than investing in children. And for all the reasons you two gentlemen noted, this is the population where we can make the biggest long-term difference. If we can make a difference in the lives of these children, it will have ripple effects for generations. And the work that you guys are doing and all of the foster parents that watch is having an impact.
What is it? What is that statement? Rising tide raises all ships, right?
Absolutely. So, I mean, as I approached this, it was an intentional move. I felt like I was in a position where I could work with this legislature, I could bring the resources at the table, and I could assemble a team to make a difference. And, frankly, I approached Monty earlier this year and asked if he'd make this leap with me. And it gave me a lot of comfort that he was willing to make this leap with me. I'll brag on Monty a bit because he's too humble to do so himself. But when he was at juvenile corrections, his goal was to be so successful and so effective running that there was no need for juvenile corrections. I needed people with that mindset. I needed people who would invest in prevention, who would bring concierge service to foster families so that they feel supported, so that they want to be in the system, so that they will retain their license. So, I felt like I could make a difference and was blessed to have people like Monty around me. So I'll let Monty talk a little bit about why he was willing to make this journey as well.
Sweet.
Thank you, Director, and kind words. And I honestly follow the Director because of his heart, and his head is aligned with the North Star as I go through my life as well, both personally and professionally. Professionally, I mentioned juvenile corrections for the last 2 decades. One of the things that was I noticed early was the amount of crossover, right? The amount of kids in the juvenile justice system that also had experience whether it's the Division of Behavioral Health with the department or with the child welfare system, to the tune of about 40%. So about 40% of kids in the juvenile justice system also have an experience, not necessarily straight to child welfare, but also Division of Behavioral Health, and specifically for child welfare. About 15% of the kids that we see at the deepest end of the correction system, juvenile correction system, came directly from foster care. So 15% came directly
Holy
from
smokes.
foster home.
That's
So-
wild.
Holy smokes.
So that's where I jumped in and said, you know what? Following Alex on this mission, on our quest, became so simple for me because I saw it on the other side too, the impact of that. Go ahead, sir. I cut you off.
Oh, I was just saying, holy smokes! That statistic is insane.
Yeah.
That's an insane statistic.
It also feels like you guys are decided to go up the river a little bit and figure out, they say like mercy is pulling someone out of the river, but justice is going up the river and figuring out why they're going in the river. And you guys seem like you're walking up the river, if you will, and figuring
Tell your
out
story,
what's
Monty.
happening.
You use this quote all the time.
Yes, sir. There's a wonderful analogy. There's a wonderful poem from the 1890s. It's actually a public health poem. It's titled "Fence or an Ambulance." It's a poem or a story of prevention. Would you rather invest in big, beautiful fences around the cliff to prevent people from falling, or would you rather invest in ambulances after they've bounced down the cliff with the trauma and the victims and the substance use and really the lifetime of missed opportunities for those young people? This director Adams, everyone in this building, much would rather build that fence around that cliff. That's some of the work we're doing with our foster folks. You guys are living examples of that. So just thank you very much for being part of that fence. I don't know if you ever thought about yourself as being part of a fence, but you absolutely are.
I mean, I think a lot, so it's probably crossed my mind before, but I mean, I take into context what you guys are talking about, and I think that fence is the foster parents, right? And as much as it is important to create avenues for people to become foster parents and empowering people to see the opportunity that they can and the difference they can make, what I'm seeing is some of this lack of resources, lack of education, and it's the deep stuff. I just recently read a book. Everyone on our podcast knows but I've read this book. It took me about 6 months because I'm not the fastest reader, but it's called "The Body Keeps a Score," right? And you realize about what trauma has done to the human body and to the human mind, and then also when you see as parents, as foster parents, I have 4 kids straight out of the foster care system, and we went from 0 kids to 4 kids in the span of a year. Right, and so that's an insane, and then the kids continue to encounter struggles at school, struggles at home, behavioral things, which all kids do experience, but ours are amplified, right? And my wife and I, fortunately, are, my wife's super educated, very smart, incredibly introspective, and then she challenges me to think introspectively about myself as well. And reading this book helped me to realize what this process has done to me, and so I'm engaging in some of the things that it's taught me, this book, while also trying to engage my children in the same way. And some of those resources just aren't there. So it's an incredible hurdle for these parents to get over, that they're constantly, every time you clear a roadblock, there's another one. So how do we really empower and educate the parent? Because getting, again, opening up the home is a great start, right? Mm-hmm. How do we move to the second step of actually creating a stable, opportunistic home for those kids to be safe and loved?
Well, first, thank you for opening your home and your heart to those 4 children. And know that you are making a difference, and we are here to support you and help you as we can. As you said, the types of children that come into the system often do have trauma associated with them. So, I think providing training and as much training opportunity to foster parents is going to be something important, something that you're going to see us invest in. But then also the supports that we provide to you. One of the things that we're rolling out on August 1st is called our Foster Parents Bill of Rights. And I'll let Monty speak to the details, but it's designed to set clear expectations for the role that the department is going to play in working with you all. You all have the right to be involved in the decision-making around the child. You have a right to timely communication from the department, including after hours and on weekends. You have a right to be able to raise concerns with the department without fearing retaliation. And I'll let Monty speak to that and more broadly.
And again, just to interject, like you're talking to two guys, we've had great experiences. Just this morning, we hit our relicensing. I won't say her name because we got to keep that stuff private, but our licensing worker has been nothing but supportive and
great.
kind along the way. And you know, it's she knows, she's probably listening. We were just talking about it, but anyways, we've had great experiences with the team that you guys have underneath you. So you're joining a good team.
Yeah.
And it's so comforting to hear that. Thank you both very much. And for lack of a better way to share this, but look at all that.
That's perfect.
Okay. 30, there are 5 different sort of categories and 26 different sort of very specific culturally what the director and I have talked about, very culturally specific attitudes and values that we are going to bring to bear. So it's no such thing as a three-legged chair, right? So it's team foster family, it's team up until a point, it's team bio family, it's team DHW, and it's team community partnership, whether that's the gals or a private provider or the combination of all those things. We can't have a three-legged chair, and we're going to refuse to do that. And I just go back to that fence analogy, man. We need so many people that are preventing our 500,000 children in Idaho from falling off that cliff. Whether that's the education system, whether that's the coach down the street, really teaching that kiddo really how to be an amazing youngster, an amazing adolescent. We need everybody in this journey with us to be part of that fence.
Well, we want to be sensitive to your time, so just a couple more questions. But
I mean, I have 100 more questions, but
so
we'll leave it to a couple for now.
And always welcome coming back on to the extent you are.
You bet.
Well, let's talk in specific to our audience, particularly as foster care and adoptive families. And so, as you enter this role, Alex, and I know Monty, you as well, what is kind of some of I know the Bill of Rights, that's an amazing thing, but what are you guys trying to kind of maybe bring fresh to these families? I know we had our bros and brews, whatever we call it, which is a bunch of beers with a bunch of dudes, and they're like, "Did you get a letter? Did you get a letter? Did you get a letter?" And they're like, "I didn't get mine," and I got mine the next day, so I finally showed up. But so it's cool to see already just kind of an intentional impression to start, but kind of what's your heart and hope for the future with this stuff. And it's cool to hear you talk about the foster family gets a say in what happens, and it's historically been a little, and not to a negative extent really, at least in our experiences, that a lot of foster parents feel like they can't, like the caseworker isn't listening to me, the caseworker is listening to mom for the 5th time, and she's telling her a lie, and I don't have anything that I can do. So some of these situations, what do you hope to accomplish in the next, I don't know, couple
Well, first, I'm glad you got the letters. I mean, that was an intentional part of outreach. I mean, I was quoted with the governor saying, these foster families are the heroes. And I actually had a foster mom say, we don't really like that terminology. These children are the heroes.
Yes,
Yeah, absolutely.
Yes.
To help them. And I'm like, that's absolutely fair. Absolutely fair. But I want you to know we hear you, we see you, we appreciate you, and we know that you're making an impact. And I want you to know from all of us here at the department, we believe you're making an impact, and we're here to support you in making that impact. The things that are going to be important to me, a lot of what I hear from foster families is they want a little bit more transparency. Oftentimes they'll get that call saying, we've got a sibling group of 3, we think the ages are 3, 4, and 5. We're going to drop them off this weekend. The
or
family
they
comes,
have no prior problems or anything.
yeah, they
and then all
don't
of a
know
sudden
if
you
they have
go,
a
"Wait a
peanut
minute."
butter allergy. They don't know
Yeah.
some of those things. So
They're potty
you're gonna-
trained. They're
Yep. So you're going to see us focus quite a bit on transparency. We had some policies around minimum transparency. You're going to see us adopt in the coming weeks policy related to maximum transparency, but maximum transparency for the interested parties in the case. That would include you all, and not necessarily media. This isn't, for media intrigue. This is to empower those who are directly involved in these cases for the betterment of the children. So you're going to see us do some things on transparency. You're going to see us do some things around visitation. You're going to see us try to not put children in situations if they were sexually abused or physically abused where they're being put in a regular cycle of having to go back with that individual. where we're going to have our North Star is the best interest of the child. And where the interest of the biological family and the child diverge, the path that we're going to take is the best interest of the child. And everything you see us do is going to be animated around that. Monty and I are under no delusion that this is going to be easy. A lot of this is going to be not just a policy change, a lot of this is going to be a culture change, and culture change takes time. We've done some early actions, and you're going to see us take some near future actions that will nudge us in that direction, but it's going to take time. So we ask for your patience, and we ask for your grace, and we ask for your help as we navigate this culture change. But it's humbling to me, talking to folks like yourself. Monty and I have probably met with, I would say, 24 foster moms and dads in our offices over the past month that we've been in office. And we're stunned at the caliber of individual that we're dealing with. These are good-hearted, welcoming, in it for the right reasons. And we need your help to make this transformation and culture change. So, Monty, what did I miss?
Thank you, Director. Just kind of maybe bring us back to the beginning. We mentioned the letters. Director Adams is so smart and got such a big heart that I promise you, had he been in charge of the Postal Service, you would have gotten your letters a week earlier. But that's the
I think I was further down the list, dude.
So when he's done here, maybe the Postal Service, but he's absolutely right. That's the focus. I just had a great visit with folks on my team, and we're so excited to roll up our sleeves and get going.
And one thing, I mean, I've talked about this elsewhere. You're going to see Monty and I bring a request to this legislature for resources. You talked about the caliber of individual that's working for the department. I've been impressed, top to bottom. We have 3,000 people that work here. We are stacked with loads and loads of talent. There are a lot of good people who work
really
here.
are.
We need to fight for them to have the resources that they need. We want best-in-class caseloads so that your caseworkers have the time to work with you in the manner that you need them to work with. We're going to have after-hour call center coverage. You're going to see us try to get folks on the prevention side to build better fences or sturdier fences. And have a continuum of care. We know this is going to take resources. We know this is going to take intentional effort, and it's frankly going to take all of us educating our legislature about why these things are necessary. So we're so thankful to you, for having a podcast like this that talks about what I consider one of the most critical issues facing Idaho. And we're grateful to you all, for having that camaraderie that you do with your fellow foster parents, and doing events where folks can share ideas. So
yeah. Now, as far as feedback for you guys, where do we bring that feedback? How do we bring that to you guys?
you guys know how to get a hold of me, and now how to get a hold of Monty.
Okay.
Do not think you're bothering us by reaching out directly. Okay. We have made this our top goal. I joked at the beginning about the sheer size and complexity of the organization. Everything from swimming pools to car repairs to Medicaid to TANF to foster care to aid for the blind and disabled to everything in between. We are one of the largest employers in the state of Idaho. When an organization like this tries to do everything, it can't accomplish anything to the depth or level that it needs. So what I've tried to do is take the inverse of that. Well, if we focus on the most important thing and we put our disproportionate time and energy into that most important thing, well, then we can at least make a big difference in that thing that I think is most important. Improving child welfare, specifically foster care, child protection, adoption. That is where I want to put my time, effort, and energy. So don't think you're ever bothering me by reaching out to me directly. And frankly, what I worry about is the higher you get in an organization, the less you get unfiltered information. Things get filtered by the time it gets to you. I want to hear from you guys. I want to hear from the front lines. What's working well and what's not working well. Both are important. I appreciate you guys giving some compliments to department staff. I joked with someone, it's kind of like when you're driving on the highway and you see the truck that has that sticker that says, "How is my driving? Call this number." No one's ever called to say, he's doing a good job. He's keeping it between the lines. He's going the speed limit.
So they always call when they're doing bad, dude.
Yeah. So, I mean, I want to hear that. I want to know where we are falling short, what we can do better, but also tell us where we're doing well. Who are the folks on our team that we should give commendations to, that we should reward, that we should celebrate, that we should promote. So I appreciate you guys giving some of that positive feedback as well, because don't assume that always gets back.
Yeah. Yeah.
Sweet. Well, thank you guys for your time. Next time you hear from me, it'll probably be for coffee or beer, and just make it even more casual than this one. But seriously, I mean, thank you, and I do appreciate. It's such a complex situation, but keeping the kids at the front. There's going to be some mishaps and some decisions that maybe we change on, we go back on, but if our motivation is right, it does lead to a long-term benefit in the end. So we appreciate it. I like that North Star. It's a great purpose. So
cool.
Okay.
Any last thing you want to say? I mean, if you were to say something to all the foster care and adoptive families listening, what would you want to say?
Yeah, I would just reiterate, you are making a difference. Thank you for doing what you're doing. From the bottom of our heart, thank you. Let us know how we can help you or where we can best support you. But you are breaking a generational issue and helping kids for generations to come. Monty?
Great point, sir. You mentioned ACEs and about how that can adverse child experience, how that can impact family trees for decades. Let's all work together to make sure those family trees are growing in a positive direction.
Very cool. Well, hey, we really appreciate you guys. Thank you for your time. This will hopefully be the first of a few times you guys are on here, huh? How about that?
Okay.
Thank you guys.
Take care.
All right. Thanks, guys. Hey, thank you, Greg, for all your help, too. Appreciate it.